One of the common age-related heart problem of the heart is the aortic valve degenerative disease, where the aortic valve becomes critically narrowed, and of course such people have to be treated with aortic valve replacement. This wouldn't be a problem in young population or a middle-aged population who are otherwise healthy and they do not have other comorbidities involving the lungs, liver, kidney, brain, etc. etc. In such people, open heart surgery can be easily done, and that is the gold standard. But if the same problem happens in elderly population because of the longevity getting increased in our population, subjecting such people to open heart surgery becomes a major issue, because in such population open heart surgery is a very big challenge, because the patients have to be put on cardiopulmonary support. There is something called aortic clamping, which has its own comorbidities like increasing the chances of stroke, dementia, etc. The average period patient has to spend in the hospital is around 7 to 8 days. This involves general anesthesia, blood transfusion, and a long recovery, sometimes up to 3 months, and with pain and comorbidities associated with a procedure. All these are acceptable in younger population, middle-aged population, but not in a high-risk elderly population. Now, because of the innovation in medical science, there is a new procedure that has been there. It is definitely there in our country over almost a decade now. That is what is called transcatheter aortic valve implantation. We are all aware that angioplasty is done by inserting a tube from the groin. The same way, a new bioprosthetic aortic valve can be replaced in the old deceased valve by a small hole in the groin as big as just 3 to 4 millimeter. This involves no cut, no stitch, and for such procedures there is no general anesthesia required, and if the pain tolerance of the patient is very good, he can even be awake with a local anesthesia, and the whole procedure can be finished, wherein implantation of a new valve happens in a course of just half an hour, and the patient is up and back within 1 or 2 days, reaching back home in 3 or 4 days. The comorbidities are extremely less.